Good morning. We'll get started here. We have a really lively conversation over here to my left. I know those folks. Good morning. It's so wonderful for all of you to be with us here this morning. As you are aware, this is the second in our three-part series that we fully intend will continue, but this is the second in the current phase of the series talking about our Together We Will initiative related to public health and public safety in downtown Denver. I want to thank first our media partners, the Buell Public Media Center and Rocky Mountain Public Media, home of Rocky Mountain PBS, 89.3 FM Cuvo, Jazz, and 104.7 FM The Drop. It's a mouthful. So can we please give a hand to our great sponsors and hosts? It is so important that we have great community partners when we host such important conversations like this. So last session, those of you who joined us, you know that we focused very much on the law enforcement side of our work. It's really important that we continue to hone in on this theme of a holistic approach, of a theme that is very much equal parts enforcement and compassionate response. That is what the situation on our streets, that's what our community is calling for today. So through this series, we're really going to dive deep in each session on different components of the program. So I see Chief Fitzgerald there, right there in the middle. Thank you for joining us, sir. So it's really important that we continue to have this type of interaction and this type of dialogue. So today, we're going to focus more on the outreach, engagement, and health and human services side of the equation. We're going to talk about today's mental health challenges, substance misuse, and the response as a part, again, of this very holistic and multidisciplinary approach. So I want to just kind of take a quick step back before we dive too far into the program. I see a few fresh faces. I see many who've been engaged from day one. We launched this initiative in November of last year, so we have been pushing very hard, keeping our foot on the gas. But for those of you who are new, I'll just very briefly take a step back and describe what the Together We Will initiative is. So this is really a coming together of two parts, of community partners as well as what we call our action partners. And all parties have committed to very specific initiatives. We've all committed to additional resources in a very concerted and coordinated way to move really our community forward, to make lasting impact. Long-term, both immediate and long-term solutions, right? Because they need to go hand in hand. So you can see here some of the specifics, what we have all pledged as a part of this initiative. And one of the things that I will continue to reiterate, that this isn't a task force for 6 weeks. This isn't a 90-day initiative. This is ongoing. This is absolutely critical that whether you are working with us on the advocacy side or on the action side, that we remain committed until the job is done, and then we commit again, right? We have to stay very, very on top of what's happening in our community for our community. So in terms of our action partners, you can see here, again, these are folks, these are institutions, these are organizations that are making a difference in the field from a tactical response perspective, committing resources every day to make a difference. We have the Downtown Denver Partnership, specifically through our Business Improvement District services with our security and our maintenance teams. Of course, the City and County of Denver, RTD, Denver PD, the U.S. Attorney for the State of Colorado, and the Attorney General, all very much committed to this effort. Our advocacy partners, you can see here, we are now up to more than 40 advocacy partners. Organizations like the Downtown Denver Partnership, individuals, our neighborhood organizations, as well as private companies who have said, we will speak with one voice, we will support our law enforcement partners, and we will commit our time and our resources to our social service partners who are helping people every day. Incredible to see the amount of support that we have in the community. One of the signature programs of Together We Will is what we call our Downtown Action Team. We're going to talk more about that today, and Ryan's going to give you some updates. This is a fantastic example of how coming together in a very concerted and specific way makes a difference. Individuals from everyone represented here are deploying in our most vulnerable areas of downtown multiple times a week together. So we have that coordinated approach. We have that holistic approach. What we are experiencing in our city is individual. It's human, and it takes that kind of approach. So with this coordinated team, we're able to go out, engage individuals, understand their challenges, and be able to address, is this a law enforcement issue? Is this someone who has criminal intent or intent to harm? Then there's a path. Is this someone who is in crisis and willing to receive services, beginning to build trust so that that long-term solution can move forward? Because of these partners working together, that's how we're finding success. So with that, I really would love to welcome Ryan Ertman, our Director of Public Safety and Security with the Downtown Denver Partnership. He is helping to work with these partners, to lead these partners in the Downtown Action Team and the effort as a whole. So Ryan's going to give you an update on our progress. Ryan.
Thank you, Kourtny. I really appreciate the summary there. That was good. It took half of my speech. We get more time for the speakers. Thank you all for being here. This is very critical that we have the engagement that we do have and your vested interest in the safety and security of our community. So I appreciate you all being here and taking the time. Since our last visit, the numbers have increased substantially. Most of that substantial increase has been because of our additional efforts and our slight pivot over to the Colfax and Broadway area. We knew that this area was going to be more resource intensive. It is there's a lot more contacts, a lot more people, and a lot more opportunities for assistance in this area. So we did know that it was going to increase, but it just went above and beyond my expectations. One of the things that February brought us as well is it brought us a lot of cold temperatures. It was very cold for a very long period of time, and it impacted not only us, not only our outreach workers, but it impacted everybody on the street. And that changed, and it obviously is impacted in these numbers. The first number that it made a significant impact on is the work that Dottie was doing. We made increases in these areas, but not as much as we had been. We had been seeing thousands and thousands of square feet and washed and painted, and it was huge on a weekly basis. But when it's that cold, they can't get out, they can't paint, they can't spray, they can't flush alleyways. So we didn't see as big of an increase on our square footage, but we did see some movement. And the good thing is we did see some areas, and we were able to see how long we were going to be able to go without the additional graffiti and the additional trash in the alleyways, things like that. So it did show us that we're making some progress. We are moving forward. Our biggest number of increase was in our contacts. This was almost 300 more than a month ago when we did our first session. Huge increase. This was, again, based on the work that we've been doing over at Colfax and Broadway. Lots more opportunities for contacts, lots more opportunities for assistance. Referrals to treatment, and again, direct connection to support. This was another area where we also increased substantially. If you remember, I think the direct connections to support was 8 on our first session, and we obviously went way above that. Going back to our efforts on Colfax and Broadway, you could talk about the opportunities we've had to refer, the things that we've been able to do in that area and get people to services. And that is exactly what happened. We saw we saw getting people to the Aid Center, the Solution Center, the Denver Rescue Mission, the Samaritan House, the hospital. All those people saw our work, and we were able to get people to those services. It made an amazing difference, and I'm very grateful for all that work. Really cool stuff, and honestly, in my opinion, some life-saving efforts that were done by our outreach team during this cold weather snap, and these connections to support, because the numbers that are not reported in there were just when somebody didn't want services, and we couldn't give them anything, we couldn't help them in any way, but the only thing we could get them was a ride to a warming shelter. We took that opportunity. That's a trust-building opportunity. we'll take you there. You're not getting in any trouble. You're not getting a ticket. We're just trying to get you somewhere safe and somewhere warm. So that's not even included in these numbers, but that was what a bulk of what our teams were doing during February. This is another number that increased pretty substantially. Notices of violation. When we began this process, we had the vision that we didn't want to just come in heavy-handed and start telling people that they were wrong and issuing notices of violation, issuing fines, and just being real, I guess, hammered about it. This time we did have to say, you're not making any improvement. We've talked to you, we've educated you, we've followed up with you. Now we're going to give you a notice of violation. The good news is that most of the re-inspections have come back in compliance. So we've been successful. The businesses are complying with the education, and we're not having to issue any fines. The only fine is one that has been issued recently, and that's the only one that I know of so far. So great work. 235 arrests and summons. Well, as we said before, we're going to do everything we can to get you help. We're going to get you services. We're going to get you treatment. We're going to bend over backwards. Our police are doing the same thing. They're always asking, what else can we do? What's the root cause? How can we get you to service? What's the barrier that's keeping you from accepting our services? If they continue to act in the ways that some of them are acting, we have to hold them accountable. And 235 citations to this point, 120 days later, is what we have. So we're doing this on all ends, and it's a last resort. We're doing everything that we can from beginning to end. One of the things that we are really proud of, one of the things that we're trying to work on is we do not believe that we have enough capacity with what we're doing to properly address the substance misuse issue. So we are trying to get into conversations and trying to build some more partnerships with our public and our private entities to increase that so that we are better serving this community that still needs help in the substance area. So that is one of the areas that we're going to continue to improve on, and hopefully next time I'll be able to announce a new partner that we have with this. And then finally, I will tell you the most exciting thing that I got in an email the other day, and it was an update from an outreach caseworker. And in that update, they said, people are finally engaging. Well, that means what we're doing is working. It means the time that we're spending is well worth it. They are actually communicating back and forth, accepting our services, and talking to our outreach providers to get that help. Eventually they will take it. So that was the most, it meant the most to me because it was a very good step in our progress forward. But I'm really excited for you to hear all of the work that the compassionate work that our outreach providers are doing right now. And I know that we have a panel of experts that are going to talk about that. So I'll turn it over back to Kourtny. And
fantastic. Thank you, Ryan. Could you guys give Ryan a round of applause, please? He's come in at not even a year with the Downtown Denver Partnership and really making a difference every day. So if I could ask our panelists to come join me up here, please. We have Evan Dreyer, Deputy Chief of Staff and Chief Strategy Officer from the Mayor's Office. Mandy Fiegel, Outreach Case Coordinator Supervisor, Denver Police Department. Chris Richardson, Associate Director of Clinical Services with Wellpower. Lorez Meinhold, Executive Director, Caring for Denver Foundation. And Tristan Sanders, Director of Community and Behavioral Health, City and County of Denver. So welcome. Thank you all for being here today. We greatly, greatly appreciate it. I'm going to start with just a very simple question. I've run through the names and the titles, but I would love for each of you to introduce yourselves, talk a little bit about what you're doing in your daily gig, and then particularly the relevance to why we're here in this conversation today. And Evan, I'll start with you.
Thank you, Kourtny. Am I on? Can you guys hear me? All right, great. Evan Dreyer, Mayor Hancock's Deputy Chief, one of Mayor Hancock's Deputy Chief of Staff. My role is largely as a coordinator and a facilitator. And in this regard here, when we decided that we needed to really work harder downtown, it fell to me to try to bring all of the different city agencies and many of the external partners together, really to increase, elevate, enhance the work that we needed to do downtown.
Thanks. Mandy Fiegel, I'm the Outreach Case Coordinator Supervisor with DPD. So I supervise all of the outreach case coordinators that are assigned to each police district, which, for those of you who don't know, we've got 6 police districts here in Denver, along with an outreach case coordinator in the Special Operations Response Team. Our role is we are on the ground doing the outreach, or at least my team is. I guess I'm there to tell them what to do, I suppose, whether they like it or not. So on Monday, Wednesday, and Friday mornings, we've got a rotating schedule, and an outreach case coordinator is there, boots on the ground, and offering those resources to our individuals. Like Ryan said, we're really seeing some success, so I'm excited to share more about that.
Chris Richardson, Associate Director of Criminal Justice Services with Wellpower, formerly MHCD. My role is I oversee our clinician programs that are more crisis-oriented. So our co-responder program that partners law enforcement with a social worker and really embeds them on how do we respond to crisis in a more efficient, trauma-informed manner. Our co-responders kind of cover the gamut of different access points between Denver Police Department, Denver Fire, Sheriff, our partnership with RTD, Auraria Campus, our new Park Ranger program, and then oversee our STAR program, which is more of the civilian-based response that is sending civilians to lower-level 911 calls and being able to support that person and getting them to the services that they need. And as it relates to the data, and kind of Ryan touched on it, is we're there to support individuals that are on the street, the OCCs that are engaging individuals. And when they're talking with people and individuals are saying, I'm ready to make a change, or I need support now, or I need that additional, being able to tap in STAR then as that resource to get that person to that specific location, whether that's the solution center, whether that's treatment, whatever that might be, and really being that partnership between what these guys are building a relationship on and being able to help make sure that we're delivering on that next level of care for those individuals.
Good morning, Tristan Sanders. I'm the Director for Community and Behavioral Health at the Denver Department of Public Health and Environment in the city. And in our division, we manage behavioral health strategies on behalf of the city. So we hold many of the contracts for a lot of the work that is being described up here. We manage the Behavioral Health Solution Center contract that Wellpower operates. We hold the contracts for the Support Team Assisted Response, STAR program. We also have substance use navigators that specifically have been deployed for the Downtown Action Team work. And so these are folks that are able to connect with individuals that have substance use issues and be sure to understand what's happening and actually refer them to where they might need to go or want to go. To everyone's point, it's important that we build those relationships. Our substance use navigators know many folks out there by name and know their situations more intimately than a lot of folks might think. And that's important for being able to get people to resources that they might need. We're trying to build that trusting relationship so that we are successful when we do refer somebody for treatment and services.
Lorez Meinhold, I'm the Executive Director for Caring for Denver Foundation. We were the foundation that was created by and for Denver. It was out of a sales tax in 2018 to specifically fund mental health and substance misuse. And so we have been doing that for the past 3 years. Many of the things you'll hear about are things that we work on, fund, partner with. So we are not only, what I'll say is we're not only a funder, but a capacity builder, a thought partner, a learning partner to say, how can we do things differently? How do we lift up maybe new solutions so that we can really think about what works best for community and really listen to community about what are the needs and how do we best respond to those needs in ways that are thoughtful, respected, understood, where people feel trust, where they feel connected to. Because we are really about creating access and that inclusive access and attention to fit and making sure there's care over time as people's needs change.
It's wonderful, and I'll provide a testimony working with Caring for Denver ourselves with our security team that so many of you are familiar with. They are trained in an outreach first model, but we have not incorporated actual crisis intervention workers into our team. We've mostly utilized partners, and with a grant that we have in the works with you, we're hoping to be able to add that specialty to our teams from a multidisciplinary standpoint. So thank you all for your incredibly important work. Evan, I want to start with you because I think it's such an interesting time when we think about, kind of why now, what's different, And certainly, this entire initiative wasn't born from one organization, right? I remember the moment in time when we were speaking with so many as the partnership, so many of you, with this call to action. What can we do? What can we say? How do we work together? And at the same time, you and Chief Thomas were strategizing on maybe new and different ways to approach it. So can you talk a little bit about the genesis of that support and how it came together from the city side, and what you think is different now from some of the other things that have been tried recently?
Yeah, I think the why now question. So much of this stems from the after effects of the pandemic and the effects of the pandemic. We were trying different things with different agencies in the city, including the police department, public health, and it was starting to feel like, well, nothing's working, and the conditions downtown aren't getting any better. So we need to do something different. The cleanliness of downtown, it was getting worse. Downtown was dirty. It seemed like there were more people out there trying to cause trouble, and we needed to do something different to hold them accountable. And there seemed like there were more people downtown who were sick, who needed help. And city government can do a lot. City agencies on their own and city agencies together can do a lot. But we are better when we are all together as a community. And so that really was the impetus for reaching out more broadly and saying, together, we have got to work on improving the conditions downtown, or we are going to lose downtown. And that is an unacceptable outcome. And so that really was the impetus for us, all trying to come together to work harder.
And we are so grateful for that. Another, I think, really important component, and I said this in the beginning, the importance of the individualized perspectives, because every human being who's experiencing a crisis in our streets has a different root cause and a different situation. So I would love to just really go down the line, and from each of your perspectives and specialties, what are you seeing? Talk about the realities of what we're seeing in downtown right now and the types of solutions that you're each bringing forward.
Yeah, so what we're seeing is there are folks that are needing help. The outreach case coordinators, like I said, are continuing to go down and building those relationships. Just from the numbers that they're reporting back to me, we are seeing a decreased amount of folks, and just that relationship building. Last time I was here, I had a question that someone had asked, what do you see as success? And that's such a hard question because success is measured in so many different ways. And I've had this conversation with Ryan. The outreach case coordinators are doing something as simple as giving a bus ticket or hand warmers to, we've had an outreach case coordinator be able to pay and help someone get back home to New York City. So success there is hand warmers. Maybe that person's hands don't freeze that day, right? That's success. Or success is getting someone reunited with their family. So it's measured in so many different ways. A simple bus ticket can help someone get to a shelter. Also, it's difficult to track outcomes because we are seeing a decreased amount of people. So I'd like to think that we've got an outreach case coordinator, gives someone some resources on a shelter, gives a bus ticket. We don't see that person again. We weren't able to track what happened. However, maybe they took that resource and now are in a treatment center, but we have no proof of that. So when you see those numbers, I honestly believe it's even more than are being reported.
I think what we're seeing more and more is individuals telling us what their need is by their story. Being able to understand a little bit, especially on the mental health and substance use side, that a lot of that stigma still exists around mental health and substance use, that it is, if you want to get better in mental health, you go and take meds, and that's the only solve for it. And being able to educate people that it doesn't have to be that way, that sometimes it is just having a support network. It's having a place you can go. It's having a social group that understands what you might be going through in the same capacity. That it's not the standard hospital system that is someone shows up, gives you meds, walks away, and you're in your isolation. It can be more than that. Same with substance use. It's not you get into this treatment, all of a sudden the expectation is you're going to be abstinent and there is no more use. That it is a journey and that we'll walk alongside you. And I think that humanistic approach of how you talk to people about that can really transform their thoughts around what accessing support might look like. And we see more change from those individuals that are just like, wait, so I can go into mental health treatment. I don't have to take meds, but I get that option. Or I can see a therapist, but I don't have to. I can just do case management, or maybe I just want to do employment. It really can be an eye-opening thing, especially when their goal may not align immediately with, ooh, I think this might be more mental health, that would be better. If they're telling me, I actually want to get a job, like use that as the way to get them interested in that next treatment, get them foot in the door to be able to start talking about different things. I think that's the most impactful thing that we've seen is that that concept of people saying that they're service resistant or treatment resistant, people tell us what they want. We just need to be better at listening and how do we help provide that to them. And I think that's what we're being able to provide those individuals that are in that area.
I think it's fair to say that the issues we're seeing around mental health and substance use are much more acute and also much more varied. And for that reason, we focus a lot on being able to provide the right response at the right time in the right way. And we're so fortunate to have partners like Caring for Denver and Wellpower and others to work alongside being able to vary the services we're offering. And so whether somebody's in crisis and we're able to bring a STAR van there to de-escalate the situation and get somebody to where they need to be, or somebody's not necessarily in crisis but needs more intentional help, that we're able to spend the time, have the right people with the right skills to learn what their story is, understand what to your point earlier, what the root causes of what's going on is happening, and how we can get them to something that not only are they needing, but they're willing to accept. And I think it's really that willing to accept part that we've leaned into more recently, which is understanding that not everybody's willing to accept the services we're offering. And so what they might accept is a conversation about their life, their circumstances now, and how we can understand what other things we can provide, whether it's a hand warmer, a bus ticket, a pair of socks, a shirt on their back, or even a ride somewhere. And sometimes one of the most successful things we do is connecting people back to whatever resources they already had, whether that's family or friends or others that can provide some of that care and support that they maybe already have in their lives. And so being able to vary those services has been a big focus for us in recent years and continues to be in efforts like this.
Just to build on what everybody else has said, it's really centered around the person. That is the key part. Nobody heals in isolation. Everybody heals in community. And so how do we find those intentional communities that people will connect with? Ones that engage the people being served as partners in the work, partners in the solution, partners in the evolution of that care, that are meaningful to them as a community. And community is not always a place. It's an identity. It is what I connect with. How do I want to come to healing and recovery? Where they are and in ways that work for them. So sometimes our systems of care work for people and sometimes they don't. So how do we also build up those community care systems, again, that reflect them, where they're going to feel that connection too? We partner with organizations, co-locate in places where people might be also getting other services, whether that's healthcare services, whether that's employment services. So if people are already there and we don't have to help people navigate so many different systems, it's much easier to accept that. And especially if you're meeting, as you said, some of those other needs. People's mental health and substance misuse doesn't exist in isolation of other needs. And so how do we really center what we're building around people that are needing those services? And then we need more between that crisis and that community stability. And so how do we really think about those levels of care? Because these are lifelong. It is not a one and done. And so again, having them engaged and connected to community means they'll stay in recovery for a longer period. So it's going to be important. I'll talk about those measures of improved mental health, reduced substance misuse. But if I only talk about that, I'm doing a disservice. I need to talk about engagement. I need to talk about reduction of stigma. I need to talk about building up skills and resilience, because that's what's going to keep those numbers of improved mental health and reduced substance misuse in the long term high.
Can I
Go ahead.
just maybe tie a couple of things together? I think Chris used the phrase that we need to do a better job of listening, and we do need to do a better job of listening. Tristan mentioned that there may be people who aren't willing or able to accept the services that we're offering. As part of the listening, we might need to change the services and offer different services until we can get to a point where the thing that we are offering is right for that particular person. But there is a balance, and I think we can't lose sight of, we've got to also hold people accountable too. We need to meet people where they are. It's always great if they can meet us as well. But I think the listening better and then adjusting our service offerings so we get more people to accept them.
Well, and I think that tees up, Mandy, what I want to hear more from you. You talked about kind of the different perspectives, whether it's a bus ticket, whether it's hand warmers. Will you paint the picture for us when you're out in the field, when your teams are out in the field? What does it look like from that first moment of engagement to figuring out what is the right service?
Yeah, definitely. Well, I need to give all the credit to my team because I've done it a few times, but usually I'm behind the desk. So they've done an amazing job. Ryan had said, we've moved a little bit on Wednesdays to the Broadway and Colfax corridor. On Mondays and Tuesdays at 16th Street Mall. So when we started at 16th Street Mall, we were seeing more contacts. So starting in the morning, going out, there's always a little briefing. The outreach case coordinators do pair with fire, which is nice because there's been times where someone is needing resources, but I remember a time I was out there, he had hurt his ankle too. So as an outreach case coordinator, the medical stuff we can't do, right? But we were able to partner there. But just starting off, walking around and giving resources, there may be someone who says, nope, I don't want anything, but we come back 2 days later, still maybe doesn't want anything. Next week they do because we know them by name. We do that, for a few hours. I'm sorry, getting back to my point now, on Wednesdays, we're back to the Broadway and Colfax corridor. There, we're seeing a lot more numbers or individuals, and what that is looking like, it sounds like it's usually about 8 to 10, 8 to 11. The outreach case coordinator, Kaylee Salinas, she's actually here today, has been going out. She's partnering, same with fire and RTD, outreach case coordinator, and spending a lot of time engaging with folks and really asking what they need. And it's, from my understanding, she's getting a lot of feedback and being able to give those folks the resources. Some of them have said, hey, I don't want anything right now, but I'll call you. And talking with Kaylee, they're following up with her. Kaylee shared with me that just a couple weeks ago, when it was one of those really cold days, I suppose we've had a lot of those, with a lot of snow, she came across a woman who was laying on the ground, covered up with blankets. The blankets were wet because it had snowed so much. And she asked, what do you need? And she said, well, I need to move, but I have no way to move. Kaylee was able to give her a bus ticket, watched her get on the bus and gave her the directions, all the information to get her to a shelter. So, I mean, that's just one thing we've done, but there's been numerous amount of resources given. And like I said, small possibly to us, hand warmers, a bigger picture to other folks. So
I've been out with some of your caseworkers.
Yeah.
And it is an amazing thing to see that gentle approach. Hey, my name is Matt. I'm an outreach case coordinator. How can I help you today? And it often ends in a success story like that, getting somebody out of the cold, reuniting them with family, getting someone on a bus to someplace better. It is the most amazing work.
And the fact that these individuals are willing to say, maybe, hey, I don't want to talk to you right now, but I'll give you a call, and they are, that's showing trust right there, which is pretty amazing.
It's really incredible. And, Chris and Tristan, I'd love for you to kind of speak to, there's a reality of what we're seeing in terms of mental health and substance misuse and those who are in crisis and the behaviors that are exhibited. So when we think about this holistic perspective, there are cases where it's a clear-cut law enforcement case. There are others where someone is having a very visceral and visible breakdown on our streets that's frightening people. We have an audience today of people who work downtown every day, who live downtown. How can we be your most effective partners? And what would your advice be when we observe those types of cases?
You know, I think specifically with those cases, it's notifying the right people. It's letting, depending on where the safety is, it's letting 911 know we need officers here, but we'd like a co-responder present as well. Because at the end of the day, we want individuals that are in that acute crisis to be able to get to a place where everyone walks away from the situation safe, but also gets them to the place that they need to go that is going to stabilize whatever might be going on in their life. But there's also those individuals that we come across, I'm thinking of one on the 60th Street Mall that was, she was in pretty acute crisis, but it was because she was feeling really sad, really lonely, isolated, and had thoughts of suicide. And that was a call that STAR ended up going on because there wasn't that safety component. And it was a community member that actually called 911 and said, "Can I have STAR come down here to talk to this lady?" And what made that unique situation is her history with hospitalizations was, well, they're going to lock me up, and then I don't know when I'm going to get out next. And so we started talking with her about what was going on, and she's just like, I don't know where to go. I don't know what supports I have. I'm new to Denver. And we started talking to her a lot more about like some alternatives that aren't a hospitalization, Solution Center being the main one. Talk to her about that being a voluntary option, that it is still staffed by really good trained people that can help support her, can get her connected to the next level of supports. And to her, that instantly lifted her mood of, wait, so I can go somewhere, I can get help that isn't going to lock me up, not going to make me feel like I'm a person with mental health, but instead offer supports and treatment and alternatives. And all that is just how do we better message out the alternative responses that are available to not only downtown, but the entire city of Denver? How do we message that STAR is available to anybody that's in low-level acute crisis that needs support, whatever that might be, and that there is still co-responders available that are that higher-level behavioral health supports? And what I love the most, and I love that Lorez is here because she basically pays for everything that I do. So,
Me too.
Yeah. I love that our teams actually get to be that unique eye in the city of gaps that we consistently see when we come across people. When someone says, I need this, and we're just like, yeah, like, why don't we have that set up quite yet? And then we get to actually turn that back and talk to our partners and say, well, how do we create something that actually solves that problem? The SOS camps, I think, came from some of that discussions. The RV places where people can legally put their RVs. So there is these kind of like, there are these forward-facing programs that actually get to shine a little bit of light of how do we actually improve our systems to be able to help those people that are in crisis. So when our communities when we do advertise at the loudest, however we can do that, here are the resources that people can call when they witness something in that situation. But also, how do we make sure that those services that we can get them to aren't just our standard, it's jail, it's hospital, or it's nothing, that there's that gray area that we can actually come up with some pretty creative and innovative programming.
I get a call or a text from your people every week, like, hey, can we do this?
I would just add, back to your question of what can be done. I mean, it's very simple. If you see something, say something, call 911. I mean, we've done a lot of work on the back end through triaging calls into 911 to ensure that the right response is going to be going out. STAR is an amazing program. It's able to, really address those acute mental health crises that are happening in the streets. It's not necessarily that person that you might be calling about is going to get arrested or is going to have interaction with the police. They may, if that's what's needed, but more than likely they're going to be able to talk to a mental health clinician and get a reasonable assessment and hopefully get offered the resources they might need. We've done so much work to ensure that the people that are going out and responding in those situations have a variety of resources that they can refer to. Chris mentioned the Behavioral Health Solution Center. It's an alternative option. It's voluntary, and it includes everything from 7-day crisis stabilization up to a 30-day sheltering. You have to come through a first responder. So you're helping somebody by calling and ensuring that that resource goes out and gets people to where they need to be. And it's similarly a great point. I mean, we hear so many things from a lot of our outreach teams of what the various needs are out there, and it's so nice to have partners like Lorez and Caring for Denver to be able to talk about that and strategize about how we bring that into being. We, you know, we think about the various resources that we offer through our office. You know, we've got a Wellness Winnie, which is a mobile behavioral health unit providing, you know, basic human needs to folks, but they're also similarly able to connect to these more intensive resources that might be needed in the moment. STAR being a great program, outreach case coordinators, co-responders. I mean, the list just goes on and on and on about the resources that could be available. And so you're really doing a service by just saying something, calling. If you see somebody in crisis, if you see somebody that appears they may need a more intensive outreach, it's there, and it can be accessed. So don't be shy.
We'll plug our app later to help with that. Lorez, you have such a fascinating and important position because you have your finger on the pulse of all of this, right? So you're really seeing this holistic picture on a regular basis. With obvious bias admitted with our panelists today, where are you seeing some of the greatest successes in moving the needle, and where do we as a community have our greatest challenges?
Thank you. Thank you for that question. And, you know, again, I should say great partnership here and great partnership with community. And that really is what's important, because what we can do also is help build those connections. So cities have a role to play in care and treatment. Communities have a big role in care and treatment. We all have a big role in care and treatment. And so how do we really connect? And then some of this is also, how do we innovate? Because if we do the same thing, we've heard this, if we do the same thing, we get the same results. So how do we think differently? That's where STAR came from. Even as we're thinking about co-responders, sometimes people think, well, that's just placing a licensed clinical social worker with police. But in fact, it's with firefighters. And we just recently added 2 to Parks and Recs. And so how do we give entry points to care and recovery in so many places? The importance of case managers. But also, how do we think about what we measure differently as well? An important part is we're dealing with the crisis, but if we don't get people out of crisis and into care, then we're not truly successful. So how do we measure that? How do we figure out how to get there? But we have been able to get close to 100 million out in the last 3 years to over 200 unique organizations and agencies. And we have been able to, our annual report that is getting ready to come out, which I'm gonna cheat on my numbers in a second because it hasn't come out yet. In the last year, we've seen a 71% improvement in mental health. We've seen, of the people served through our grants, we've seen reduction in substance misuse, around 75%. We've seen 94% of folks not touch, not enter, or not recidivate within the justice system because of mental health and substance misuse. And it is this collective approach that's doing it, and really focused on equitable outcomes for mental health and substance misuse in this path as well. And so that's all super important. And so when I talk about those numbers, what it really is that we've made sure that, and when I say we as everybody here, we as everybody in the audience, we is those 200 organizations. So I'm not saying we caring for Denver. Everything we do is in partnership and collaboration. But 6,000 Denverites receive clinical services, 23,000 Denverites receive care in communities, 4,000 engaged in recovery spaces, 200,000 were reached with messages about trauma and healing, and we funded over 200 organizations to deliver and lift up and say, we all have mental health. And sometimes it's good and sometimes it's not so good. And so we can recover together in the ways that reflect us. And so the impact we're having is great. And it's great to say all these numbers, and truly, what does it mean? The meaning is the stories we get as well. So Safe Outdoor Spaces is one of it. It's Colorado Village Collaborative. They work with communities that are unhoused. And so what we have funded in each of the sites is a licensed clinical social worker and a peer specialist. And a peer specialist is somebody that has gone through recovery themselves, likely unhoused, misused substances, might have touched the justice system, but they've been trained in recovery so that both they can protect their own recovery but help other people towards that recovery. And because of that placement, over this last year, in those safe outdoor spaces, 72% of folks connected to services, medically assisted treatment, substance misuse services, mental health services. That's incredible engagement. And it's because it's in places and spaces they're receiving other services, they feel that they can get care in a non-judgmental space. And so we need to keep on thinking about how we create more spaces of healing.
So well said. Well, I have a very long list of questions still to go, but I do want to pause and see this is so important that this is a dialogue, and that's one of the commitments that we've made through this initiative, that this isn't etched in stone. It's not a plan that's solidified. It's a plan that takes discussion and feedback and participation from everyone here. So with that said, we'd love to entertain some questions and comments from you all. So popcorn style, stand up, we'll run a mic out. Question do we have here in the middle?
Hi, I'm Alyssa with Civic Center Plaza, right on the corner of Colfax and Broadway. And I want to say that over the past 6 months, we have seen a major improvement in the amount of activity we've had in and around the building itself. And I did want to ask, is there something that we can do as property owners to help get the information to the resources available to the people that are coming onto the property?
The city definitely has some source guides that we can get you and everybody to different types of services as well. And thank you for pointing out the improvement. I think that corner is one of the most troublesome areas in all of for a long time, and it does take a significant concerted effort. I think pivoting the downtown action team to that area was not part of the original plan, but it had to happen.
How are y'all? Thank you for being here and for all the work you're doing. I'm Stephen Shepard with BOMA Denver Metro. And one of the questions I have is, what happens to someone who refuses services but is obviously someone that is not capable of making decisions, whether they're because of their mental state, because of their, if they're in a drug-induced situation or things like that? What can you do to ensure that, because it's not humanity is not there when they're kind of can't make that decision to seek the resources that y'all have, and they need them, right?
I think we use the tools that we have available in the system that we have available. So we would always assess someone whether or not they meet a grave disability threshold, and based on that determine if we need to actually take an intervention that actually gets them to a place that is more stabilizing, typically a hospital setting. But in those situations where not everyone falls into that exact blanket criteria, but we still recognize that they may not be in a place that they can accept help, or maybe it's they're still pre-contemplative, they're really not tipped over into how the concern really could affect you, especially individuals that are negative 20-degree days. If the mental health is impacting their decision making on that, we usually get together as a team and kind of game plan what strategies can we apply that actually pull other communities in. We're talking directly with Denver Health, possibly. We're talking directly with maybe even Colorado Access, the insurance provider, to say, what can we actually provide for this individual, and wrap them around in services that ensure that they can be safe, but also give the ability that when they are ready to make a change, they can start adding to that. Not a perfect system, but it gives people that at least we want everyone to be voluntary, and we also want to make sure that they have safety nets attached to them should they not be ready to make those changes. At the end of the day, we want someone to be able to have that conversation ongoing, and if it ever hits that point where we might not see you tomorrow because it's too cold and you might freeze outside, we want to make sure that we're taking the steps to still have that conversation in the future.
That is the hardest question of all, and it's the thing that we all grapple with the most. How do we as systems, as community, handle a case like that, a person like that? And that's today in cities all across the country is probably the hardest question that we're wrestling with. You've seen Mayor Adams in New York try to roll out a new approach. The California Care Court model is another effort. There's a piece of legislation here that's being heard in the Colorado legislature this session that addresses this issue. We're working on a potential pilot as well. It's the hardest question of all.
Good morning, everyone. My name is Elber Wedgeworth, and I'm glad you said Denver Health, young man, because that was my question. I basically am working with Donna Lynn, the new CEO of Denver Health, and we really would like to enhance our relationship with all of you and be more of a partner. And like to hear from all of you in terms of ideas or suggestions you have, and how I can help be the liaison between you and Denver Health Services, not only our mental health services, our community clinics, Denver Cares. I mean, we have, as a safety net, as you know, we have all these different types of services and very committed employees that are wanting to work with you and do. So that's my question. Hi, Evan.
Well, I mean, Denver Health role in all of this right now, everything from beds in the facility to paramedics out on the street. And I think having a new leader in the form of Donna Lynn is great. And so we will take you up on that offer. We're already talking to you all about how we can enhance and increase services, particularly when it comes to serving people on the street.
I'll just add, Elbert, good to see you again. We already work with Denver Health in so many different ways. I mean, I think it's really about improving on what we're already doing. You know, you mentioned Denver Cares, STAR. Denver Health is an important partner in STAR. I think there's ways that we can expand on what we're already doing, and we're already in discussions about that. I echo Evan's sentiments. You know, it's great to have Donna Lynn here. I used to work with her at Kaiser, actually. She's phenomenal. And, you know, I welcome the conversation about how we can continue to build on what's already in place, but already such a trusted partner that we work with in many different ways. So thanks.
And I'll just add, Denver Health has been a funded partner as well. Have an amazing the school programming, the in-school programming. We've added capacity around mental health. We've added capacity around prenatal screening for substance misuse, in conversations with Dr. Thurstone around workforce, because we know that's an ever-growing issue. So part of the challenge I know that Denver Health struggles with is they can't keep all their beds open if they don't have the workforce. So how do we think about pipelines that reflect community, and really think about how do we grow that capability so we can keep on funding positions and organizations, but if there's nobody to step in, that's a challenge. So there's many ways we look to continue to partner with Denver Health, but Denver Health is a key partner and player in this mental health and substance misuse. And I think also needs additional resources so that they can serve and really think about how, I know one of the challenges in talking to Donna is sometimes you have people brought and you can't keep them, but you have nowhere to put them safely. And so again, it might be crisis, but then how do we get that connection to care? And so there's plenty of places that I think we can all continue to partner with.
Hello, my name is Sal Tripodi. I'm a resident in downtown and interested in what you all are doing. And thank you very much for what you're doing, and in particular, the community that you help build for these people. I have a brother who suffers from very severe mental illness, and had he not had the family sticking behind him, I think he would have had a very different experience. And so there are many of these people on the street who don't have that support, and that's what you're helping to create, and I thank you for that. I wanted to know what the process is when a sweep is done of a street encampment, and how some of you might get involved with that. What opportunities do you try to avail yourself of when that's happening, when people are being moved from where they have been camping? And you know, are there services that are provided at that time, or what's the process? I don't really understand it very well.
So when there is a large encampment, the city will come in and post a 7-day notice that that encampment is going to be cleaned and closed in 7 days. And what has happened virtually every time prior to that posting of a 7-day notice is that outreach workers of all sorts, including from these organizations here, are spending time in that encampment trying to connect folks who are living in that encampment to services and other types of settings, better settings, safer, more stable settings. Then there's a posting, and then that work continues. It intensifies over the next 7 days. And then on the day of the actual cleanup, outreach case coordinators, Wellpower case coordinators, our early intervention teams, surge into an area and try to really make the connections happen on that day of the cleanup. So sort of a long-winded answer of saying, yes, services are offered repeatedly leading up to and on the day of a cleanup.
In some of these situations, especially as like our new housing systems kind of get created, social impact bond, the CIPRA, I think there's a Swishy grant that's currently out. It's individuals that have already been identified as, hey, we have housing for these, but we can't find them. And then these teams really can be the eyes on the ground that have a list of people that it's like, hey, we just get to give you the greatest news on the face of the planet, and we just happen to come across you right now. It's just, those are the moments where we actually get to tie some of these systems together and be the bearer of good news, and then actually get those individuals. And I think on the encampments or the sweeps that we are on, we're actually encountering those more often than not, where we find the person that someone's been looking for forever, and then it's connecting them to that service, and then they're getting housed, and they're getting wraparound services attached to it. And in in past history, there wasn't any of those connection points. It was still, where's Waldo, finding someone, a needle in a haystack. So I think as we kind of improve some of those things, we're going to continually use these teams to be the middle to get everyone to the right place that is service connections.
And I'll piggyback on that. We see that too. We'll get a list, and if someone doesn't have a phone, which we see a lot of times people who do have phones get them stolen or they can't afford one, there is no way for these housing complexes to get a hold of them. So if we have a list, we can be that connector, which is awesome. Kaylee, who obviously needs a raise because I keep bringing her up, actually was working with a woman in a shelter, and they were, discussing her getting housing. And Kaylee, they didn't have a way to connect other than Kaylee going to the shelter all the time. So with some limited funds that we have, Kaylee was able to get her a phone. She turned her phone on and found out she had a Section 8 voucher and had no idea, and wouldn't have known that without our, the help of just that communication. So like Chris said, just us being that connecting person has been really, really great.
Well, we are actually out of time. I'm getting the little sign down here. An hour goes by fast. I do want to mention Chief Fitzgerald and all that you're doing with RTD. It's really incredible, and I have to commend the work that you all have adopted a very similar model in what you're doing, because we know that our public transit system is such an important part of our city. So thank you for all that you're doing as well. Absolutely. So I think, a few takeaways from my perspective as I've listened to all of you. It's so incredible. One, I think this theme of obviously collaboration, that's the obvious one, right? Partnership and collaboration is absolutely key. I think this importance on being nimble, and I'm going to say it again, the individualized approach, turning on a phone and learning that you have a voucher. That's incredible. I think we all need to give Kaylee a round of applause, apparently.
And a raise.
And a raise. Because that truly is where the difference is made. And I think in terms of what we can all do to continue to support all of this important work, one, I would beg of you, talk about it at dinner parties, with your teams. Talk about the work that's being done, the action. I find so often that defining the they, what are they doing about it, really helps to empower our community to get involved. So talk about this work, learn about it, learn how to be an active participant. Lorez, you said it so well. We are all a part of the solutions here. And that's really what Together We Will is all about, how we can all be a part of the solutions moving forward. So thank you all for joining us. This is the plug I promised you. We have an app, our Clean and Safe app. That was another theme today. If you see something, say something. So when you're in the downtown area, you can use that app that goes directly to our dispatch team, to Sir Ryan over here, who's helping to ensure that if it's our teams who can respond, we are there in a hurry. And if it's another team, we are in close contact with PD and all of our social service partners as well. So please make sure that you download and utilize that app. Session 3 will be coming up in April. In that session, we're going to be talking about really the judicial side of this, taking it from law enforcement, outreach, and then how the judicial system is a partner in our efforts as well as a community. So again, downtowndenver.com/safety is where you can find more information about this initiative as well as our regular updates. And I hope to see you all in April. Thank you for being here. And thank our panelists one more time, please.